Ossification of the femur. So the ossification begins with the nutrient arteries. It is a branch of profunda femoris entering the shaft. The femoral head is supplied with the medial and lateral circumflex femoral arteries. And also we have metaphyseal and epiphyseal arteries which nourishes the end. Note that the femoral neck fractures can disrupt head's blood supply, leading to avascular necrosis. So the next is in applied anatomy, we are just going to deal with, or we are just going to concentrate on muscle attachments. So here at the proximal end, we have gluteus maximus on the greater trochanter and iliosposa on the lesser trochanter. And on the shaft, we have quadriceps anteriorly, hamstrings on the linea aspera, and distally we have gastroceminis and popliteus. These support hip flexion or extension and knee flexion or extension. In applied anatomy, the fractures include femoral neck in the elderly and the shaft from trauma, and distal femur. Hip dislocations are often posterior. Sometimes with acetabular involvement, avascular necrosis affects the femoral head due to blood disruption. Growth plate injuries like spilled capital femoral epiphysis occur in adolescents. And now we are going to see about the summary. So here in summary, the femur is the longest bone connecting to the hip and knee, and also over the parts like head, neck, trochanters, shafts, and condyles. Ossification has a primary center in the fetal period, fusing about 20 years. Blood from the profunda femoris and circumflex arteries clinically proven to the fractures and dislocations and avascular necrosis. So we are just calling off this session, and I will ask some questions so that try to answer these questions, or I would. Okay, so the riddle starts, and so the first riddle is: I am a fused trio in a pelvic domain, bearing weight without complaint, linking spine to legs with grace, guarding organs in my space. Who am I? So the answer is Hipbone. It is composed of 3 fused bones, ilium, ischemium, pubis. It forms the pelvic girdle, which connects the axial skeleton to the lower limbs. It also supports the weight bearing and protects the pelvic organs. So we have the next question or next riddle. Superior and wide part, with a crest you can feel. A fossa inside with a muscle concealed. Spines anterior and posterior to a notch for the nerve to pass right through. What am I? So the answer is the ilium. The superior part of the bone featuring the iliac crest, which is palpable at waist, and iliac fossa for iliacus muscle, and the spines greater sciatic notch for the sciatic nerve. So the answer is ilium. Next question is a deep socket where the thigh bone docks formed by 3 parts like building blocks, pivotal for the hip joint, swinging, enabling walks and everything. What am I? So the answer is acetabulum. A deep socket in the hip bone formed by ilium, ischemium, pubis. It articulates with the femoral head to form the hip joint, crucial for the movement and weight bearing. So so the next question is regarding femur. So it connects the head to the shaft. And I'm narrow and prone. The fractures here make the elderly groan. Angled for balance in every stride, but the blood supply can be denied. What am I? So the answer is femoral neck. So the explanation is that it connects the femoral head to the shaft, and common fracture site, especially in the elderly, angled medially. The fractures can disrupt blood supply, leading to avascular necrosis. And also, so the next riddle is the longest and strongest in your skeletal group from hip to knee. I carry you through bowed shaft with a head so round, trochanterus with the muscle tightly bound. What am I? So the exact answer is femur. It is the longest as well as strongest bone located in the thigh, connecting pelvis to the knee. Features a spherical head, neck, trochanterus, and slightly bowed shaft for the weight-bearing locomotion. So, hope these riddles help solidify your knowledge of the hip bone as well as femur. If you want more or answers explain further, drop a comment, like, share, and more for anatomy fun. Thank you.